There were 4 more COVID-19 related deaths in Alberta in the last 24 hours. That brings the total to 44. Also, 82 new cases reported for a total of 1,651. Now, despite the higher number of cases, Alberta is still significantly lower than forecasted just a few days ago. When you look at the hospital and intensive care numbers and zoom into where we should be right now, we were projected to be over 200 in hospital. We're currently at 44, as well as it looks like around 40 in intensive care. We're at 14.
Here's the good news. People have been following the public health guidelines. They've been acting responsibly. They've been doing the right thing.
Well, it is good news. It begs the question, why were the projections so far off?
Let me be totally transparent about this. Early on, we as government were not getting very much from the system in the way of models. And I was frustrated with that because I found it very hard for us to know how to prepare, what kind of resources we needed to put where.
Kenny says he pushed Alberta Health Services hard to get a model in place. Hundreds of scenarios were considered.
In part, it was built on the experience that we saw in the United Kingdom because our epidemiologists, economists, and others who developed the model needed some kind of baseline upon which to base it.
The original projections also indicated that Alberta could be running low on personal protective equipment. That's obviously not the case anymore. As you heard on City News yesterday, Alberta now donating personal protective equipment to BC, Ontario, and Quebec. Reporting from Edmonton, Kvnarmstrong, City News.